And then we talked a lot about this during the sporadic workshop, is how frequently is it, and that 1 in a million number. So we talked about in the workshop that the 1 in a million number is the incidence, which is a statistical or epidemiology term used for public health. It just means the number of new cases that happen every year over a given population. But as you saw in the slides earlier, not everyone gets prion disease. It's more a mid to late life. So when you include things like infants and children, it kind of dilutes out that number. And actually, the harder you look, the more likely you are to get to 2 per million per year. But as you can see, that incidence number is very different depending on the age. So this is, if you look at all ages, it's about 1 to 2 per million. But if you look at young people under the age of 65, it's drastically lower. If you look at older people, it's actually much higher, 4 to 7 per million. I would recommend when you talk, especially on Monday, to your representatives, when you talk to people at home, that you don't use the 1 in a million number. People know 1 in a million as, it was described in the sporadic workshop, as like a lottery winner. This is not winning the lottery, right? And we don't want to kind of use that term to connotate a rare disease. So another way of looking at it is how many cases of, how many deaths in the US every year are due to CJD. That's also a lifetime risk. So if you look at that number, it's about 1 in 6,000 US deaths every year are due to CJD. So in my opinion, that's probably a more psychologically accurate number when we talk about frequencies, which is most people here are going to be talking about that. They're not going to be talking about public health statistics like incidence. So what does that mean, though?